Okay, now we want to assess the patient's perception of the precipitating event. This is the initial task for the nurse crisis worker. So you're going to be determining whether an event is a crisis. An event is a crisis is based on the perceptive and strengths of the patient. So again, how does the patient perceive it? There's sample assessment questions on page 402. There's 7 questions. Please look at them. You need to view the event through the eyes of the patient. Crisis is a physical example on page 402 talks about a crisis for a patient who may have schizophrenia. Something as small as a physician's appointment being canceled by the office. This may cause a patient who is schizophrenic to experience what we call disorganization. Just because you think something is simple or is no big deal, to someone else, it may be a precipitating event to a larger event. So make sure you always look at it through the patient's eyes. And please look on page 402 at the 7 questions that are there in your text. So you're looking at the 7 questions. Okay. Assessment and interventions continue. There's questions on page 403 here, and look on page 405 of your text. So you're going to look on 403 and also look on page 405 for references for here. Assessment and interventions of crisis. You can read the slide. What I want to point out is that you need to be calm, provide a quiet presence, listen to the patient, use assessment guidelines. Does the patient's response warrant psychiatric treatment? You want to make sure after doing your assessment that the patient is not in danger for hurting themselves or others. We want to, again, look at assessment guidelines continued. Identify suicidal behaviors, psychotic thinking, and violent behavior. Assessing patients' personal coping skills is going to be very important. In crisis situations, evaluating the person's level of anxiety is important. Have you thought of killing yourself or someone else? These are very important questions that you want to ask the patient so the nurse can make relevant referrals and implement appropriate interventions. We know that if a person is answering positively to any of these questions, we want to make adequate, expeditious referrals, and we don't want to leave the patient unattended. Nursing diagnoses. You didn't think you were going to escape these because we were doing mental health, right? So there's table 20-1 on page 404. You can look at, table 20-1 on page 404. Includes signs and symptoms. Also, there's a vignette there that is very helpful. So looking at, you can look at interventions. Make sure that they include patient safety and anxiety reduction. Anxiety reduction. As you read through the chapter, you'll be able to figure out etiologies and signs and symptoms as to why your patient may be experiencing the nursing diagnosis that you see. But again, there's a chart on page 404. Looking at, we have just a couple more slides to go. Levels of nursing care in crisis. Primary care, make sure that you're recognizing the problem. On page 405, there's a table 20-2, interventions for patients in crisis. Primary, you want to teach coping skills, evaluate timing of changes. And secondary, level of crisis intervention, make sure that safety is first. Make sure, see if the patient needs to go to a hospital, to an emergency room, to a clinic, whether they need to be Baker acted or put into a mental health center. And the tertiary care provides support, as it says here. That could include rehab, workshops, day hospitals, outpatient clinics. Prevent further emotional disruption in your patient is primarily what that tertiary care is for. Foundations of crisis intervention. The higher they are right here, it tends that your patient is very satisfied with the interventions, that they're very satisfied. A tertiary or critical incident, stress debriefing is something that is going to be done. So foundations of crisis intervention. A crisis is self-limiting and is usually resolved within 4 to 6 weeks. That is the goal. Another goal of crisis intervention is to return the individual to their pre-crisis level of functioning that we've mentioned already. The resolution of a crisis results in achievement of 1 or 3 functional levels. The person will emerge at one of the following levels. Higher than they were before. So they're very satisfied. The crisis has been resolved. They'll either be the same or they'll be lower, which means they need further interventions. Again, in evaluating crisis, the nurse must assume that the patient is in a state of disequilibrium when they're assessing them for crises. Now, when we get to critical incident stress debriefing, you will see that in the mass casualty. This is a tertiary intervention, and it is abbreviated CISD, critical incident. So stress debriefing for a group that has experienced a crisis. There's 7 phases. You can look at page 406 of your text. Make sure you're familiar with this. Patients go through group meetings, offers individuals a chance to share their thoughts. And again, when we're doing the crisis intervention, we must assume that the patient is going through a state of disequilibrium, that they're not normal. And they're not emotionally normal because of the crisis. And what we want to, again, get them to the same or a higher level of functioning to be considered a successful intervention for this patient. So crisis intervention is used to debrief staff members on an inpatient unit after a suicide of a patient. Remember, we have to include the whole team. Staff members after incidents of patient violence. Crisis hotline volunteers that have reports coming in of people committing suicide or other different crises. School children and school personnel after shootings have occurred in a school. Usually those teams consist of nurses and psychologists and social workers and public health workers. Rescue and healthcare workers who have responded to a natural disaster or a terrorist attack. All of these need critical incident stress debriefing. Finally, on 406, you'll see crisis incident stress debriefing. You'll see the 7 phases listed as they're listed in your PowerPoint. The introductory phase, we talked about the purpose of the meeting is explained. An overview of the debriefing process is provided to the participants. In the fact phase, participants are assisted in discussing the facts of the incident. And we want to know what that patient's perspective of the event is. In the thought phase, all the participants are asked to discuss their first thoughts of the incident. So what were your initial reactions? That way we can assess how, if a person has any suicidal tendencies or what their level of disequilibrium is. Then we move on to the symptom phase. Participants describe cognitive, physical, emotional. So what were your symptoms? What did you experience based on this incident? How they felt following the initial experience. And then we move to the teaching phase. We want the participants in the group to be involved in stress management techniques, and we want to show them how to do this. We affirm that they did experience something, and we see how we can help them. And then reentry, participants review old material discussed and then we debrief them. We talk about the different topics, and we do a lot of reassuring. The nurse will do a lot of reassuring and provide handouts and other written materials so that they can go over them later. There are several vignettes in your chapter. Again, this information is on page 406. A couple slides up, we talked about the evaluation phase. Know that takes place 4 to 8 weeks. The evaluation phase of the CISD takes place 4 to 8 weeks after the initial interview. So this is not a one time they go in, they receive counseling, and they go home. They receive continued therapy and they are reassessed. When you're finished, you want to find out, is this patient safe? Did they develop better coping skills? What is their level of stress and or anxiety? Does the patient have stronger existing support system? Have we helped them to develop or find more supports in the community, in their church, in their family? Has the patient maintained an optimal level of functioning? And have they returned to their pre-crisis level of function, or maybe they leveled up? So we keep talking about where the patient might go. So following this, there's a vignette. You can read that. And then on page 409, there's some key points that'll help you with your objectives. And then to kind of test your knowledge, you can look at the chapter review questions when we talk about what a crisis is. See you at the mass casualty event.